hour. So please feel free, if you are on your lunch hour, don't feel like you can't have your lunch, please do that. We invite you to participate and be part of this. So I want to welcome you to the fourth session of our Community Behavioral Health Information Technology Coalition. Today, we're going to be talking about strategies to increase patient portal adoption. And I'm going to remind Lori you are recording. Good. All right. So my name is John Glover, and I'm going to be the facilitator for our session today. If you were in time to see some of the information on our slides, we're going to ask you to maybe enter your name and information into the chat so we can kind of keep track of attendance. So, you know, who you are, maybe your email address and where you're from, that'd be great. So let me go over the agenda for today. We're going to start off with some announcements, just a couple of things. We'd like to do a quick poll as we get going. Then we'll do some introductions of who's with us today. And then our topic presentation today will be from Melissa Kempfer of Church Health Services in Beaver Dam. So we're really excited that she was able to join us and present this today. She's got a lot going on, and so she's going to juggle this and fit it into her schedule. So thanks a lot, Melissa, for doing that. And so then after her presentation, we'll have some discussion. And this is where, you know, we really separate ourselves from a webinar, that this is really not a webinar. It's intended to be an interactive group discussion around this topic. And we're really curious and interested in what your experiences are. And at the end of that discussion, we will do a quick review of some resources that we've put together and we will send out and make available to you. Alrighty, so let's start with the announcements section. And before we get into announcements, this is where we want to start off with our first, our pulse check poll. We've had a few CBHIC sessions and we need to provide some feedback to DHS regarding how this has been going and how it's been useful for our participants. So we've got a quick 4-question poll here, and Lori, are you ready to put that up for folks? If you could just take a moment and go through this poll for us, and then we'll give you a few moments to do that. You can scroll down. I think
there are 4 questions, John, and yes, if everyone would just be able to just go ahead and scroll down if needed.
All right.
This is our 4th CBHIC meeting, so.
People. And we know that some of you may be joining us for the first time, and if so, we understand if you don't feel able to respond to the poll.
Okay. All right, and with that, I'm going to wrap up the poll, John. It looks like most, one moment. And here we are. I'll share the results real quickly as well.
All right. So it seems like in general, people rated the quality of the meetings good to excellent, and some nice, good responses in terms of the topics. And that's good because we try to ask you all what topics are important to you and you would like to discuss. And it looks like the format works for people. And then we have the resources. Good to know that those are helpful. And feel free, if you have resources when we're discussing that you would like to share, to put those in the chat, because those are always appreciated and helpful as well. All right, thanks, Lori.
No problem.
So in terms of other announcements, we'd like to sort of let you know that our Metastar Health IT Radio podcasts are available on our website. The most recent episodes, number 15 was Social Determinants of Health, SDOH overview rather. And then the 16th one, the most recent one, is Information Blocking in Small Practices, which I'm sure you all know is a very big issue currently. And so we've tried to provide some information on that. You can find both of these at www.metastar/podcast or on your favorite podcast platform. Maybe we could put that link in the chat for people. Would someone do that? That way people can grab that and they can find it. All right. So please check out the podcast. There's a lot of other good podcasts on that list when you get to that website. So you may find some other things that you're interested in checking out. Those are generally about 10 minutes long, so they're quick and easy to listen to. So I'd like to tell you a little bit about our group process here. As I said before, it's not a webinar. This is really a topic-focused learning group. We want to spend the majority of our time giving you time to talk together about this particular topic that Melissa's going to present today. And we have a topic presentation form that we've asked Melissa to fill out, and other people have done so. It's very short and quick. The intention is to kind of get a sense of what are the issues and get the discussion started. So please join the conversation. We're all here to learn from each other, and we appreciate your input and knowledge that you can add to the discussion. So next on our agenda is introductions and roll call, and it looks like we're growing steadily here, so that's great. Let me see. I think this might work for me. I'm going to try and go through my participant list. Sometimes it jumps around, so bear with me. And if I miss anybody, I'm just going to ask you to speak up and introduce yourself. But I'm going to go down. Patty, would you mind starting for us?
Oh, sure. So I'm Patty Conley, and I work at the Vantage Point Clinic and Assessment Center in Eau Claire. Yeah, so we're a smaller clinic, so I have a lot of different roles, but for the purposes of this, I'm a HIPAA compliance officer there.
Great. Thanks, Patty. Melissa, I got you next. You want to just briefly say something?
Sure. So my name is Melissa Kempfer, and I am the Mental Health Program Manager with Church Health Services in Beaver Dam.
Great. Anna? You're muted, Anna.
That tricky unmute button.
Right.
My name's Anna Winton. I'm a licensed clinical social worker and director of the St. Croix Tribal Behavioral Health Clinic in Webster, Wisconsin, Northwest Wisconsin.
Great. Thanks, Anna. Then I have Becky.
Hi, I'm Becky Eberhardt. I work at Journey Mental Health Center. Can you hear me okay?
Yep.
Okay. I work at Journey Mental Health Center in Madison, Wisconsin, and I'm in charge of marketing, communications, development, a lot of other little things.
Yeah,
Nice to meet you.
great. Thanks for joining us. Claire, would you mind introducing yourself?
Hi, so I'm Claire Lewandowski, a psychologist with Kenosha Community Health Center here in Kenosha and the behavioral health supervisor.
Thanks, Claire. And let's see, Connie.
Hi, I'm Connie Gadarian. I'm the Administrative Manager for Behavioral Health Services at Memorial Medical Center in Ashland.
Thank you. And Dan, Dan McWilliams, can you start for us?
Sure, I'm Dan McWilliams. I'm the Director of Crawford County Health and Human Services in Prairie du Chien, Wisconsin.
Great. And then I got Dan Williams.
Dan Williams, Director of Greene County Human Services down in Monroe.
Thank you. Great. And Fern?
Hi, I'm Fern Conitz. I'm a in-home child and family therapist with Orion Family Services in Madison. I'm also the CQI manager for the agency.
Thank you, Fern. And then I have Lisa Kay.
Hi, Lisa K. Spurbeck with Brown County Health and Human Services. I'm a systems specialist.
Thanks, Lisa. Appreciate you joining today. Paula? Paula, you're on the phone. Let's see. I don't know. Do you know how to ask her to unmute?
Mhm. Here we are.
Now, can you hear me?
Yep, we can hear you, Paula. Thanks.
I'm Paula Sladek from Crawford County Health and Human Services in Prairie du Chien, Wisconsin, and I help take care of our EHR.
Great. Thanks, Paula. And then I've got Samela.
Hi, everyone. I'm Samela Jolly. I'm the Director of Clinical Services here at the Guest House of Milwaukee.
Thanks for joining, Samela. And then I have Sandra.
Hi, I'm Sandra Masker. I am with Health and Human Services of Waukesha County, and I am over the business application support. I'm IT for Health and Human Services in Waukesha.
Great. Thanks for joining, Sandra. And then I have Shannon.
I am Shannon Esla. I am the Recovery Services Program Coordinator at Behavioral Health Services at Memorial Medical Center up in Ashland, Wisconsin.
Great. Thanks for coming. And then Taryn.
I'm Taryn Pratt. I'm the Health IT Tech at Unified Community Services here in Grant and Iowa counties.
And I think last on my list is Tom.
Hi, Tom Trin, Ozark County Human Services System Administrator.
Great. Thanks, Tom. Did I miss anyone? If so, please speak up. I don't think so. I think we got everybody. And then, of course, we have our Metastar team, Chris Becker, Lori Mantefel, Lynette Hesse, and Julie Schmelzer are all backing me up today in different roles. So thank you guys for participating and helping us out, and we'll hear from them from time to time. All righty, so without further ado, let's get into our topic today about patient portal adoption. As I said, our presenter is Melissa Kempfer. She's from Church Health Services in Beaver Dam, Wisconsin. So Melissa, I'm going to ask you to just go ahead and introduce yourself a little, tell people what your roles are there, because I know you have more than one. So, and then you can walk through the presentation for us and we'll start the discussion, okay?
Okay, sure. So I have been here with Church Health Services for almost 5 years. And I have been the mental health program manager for about the last 3. So a lot of stuff is really new to me, and being a smaller nonprofit organization, we sometimes go with, free programs or, more cost-effective programs and things like that. I personally, I think, was a little spoiled because my son has Dean health insurance. And so everything that I do for him, I do through Epic and through my chart. And when we got therapy notes and I saw that it had a patient portal, I was really excited, and I thought, oh, there'll be, things down the line that we'll be able to do with that. And it's really cool because with Epic, we're so interactive with his care team and stuff. And so I thought, oh, things will make my job a lot easier and we'll be able to communicate better. And it wasn't really a huge priority, but, it was just kind of there in the back of my mind that Therapy Notes offered it. And then as COVID hit and things were shutting down, and we had a good number of clients that, wanted to take a telehealth appointment versus coming in. And we also had a pretty good number of new clients that were coming or that were calling that wanted to come for services because of course they were, confused and scared. And So the problem became, how do I get them paperwork when they don't want to come in person? And so I thought, oh, the portal, this is my chance to use it, to try it. And I was very disappointed. It was not user friendly on my side. It was not mobile friendly on the patient side. In order for me to create our paperwork and upload it so that it could be ready for the portal was very cumbersome. I was hoping I would just be able to take the documents that I already had and just upload them and turn it on and say, yes, share in the portal. And that didn't work the way that I thought it was going to work. A couple of patients, I actually had approached a couple of clients who were still coming in person at the time, but they had been sort of longtime clients of ours, and they were technology savvy enough. And so I thought, well, I felt comfortable asking them, hey, I want to see how this works. Would you mind testing it with me? The forms were not easy to fill out on their side. It was the whole, you have to make the screen bigger, and then you're trying to, it was just not friendly on their side at all. And we really serve, it's funny because you would think, well, I don't know, I guess before I started here, I guess I thought that we would have less clients that have smartphones. And actually, most of our clients have smartphones, and that's it. That's their lifeline. So they don't have a desktop at home. Maybe they don't even have internet at home to even have a laptop or a desktop at home. So asking them to use the portal that way was not really conducive to, the clients that we serve. And so we recently found out that there was a grant that our executive director had applied for, and that in part of the grant will include a year's service with UpDocs. And so I'm very excited. I have not had my training yet. But I'm really excited. I'm hoping that we will be able to maybe find some new things in UpDocs that we are able to do maybe a little bit easier. Just some of the things that I would like to be able to send out the intake paperwork ahead of time and have them be able to fill it out and send it right back through the portal to me, and then be able to upload it from there, right into their chart. A couple of meetings ago, or a couple, times ago that we all got together, we had talked about wanting to reduce faxes and reduce paper that way. And this is another way that I feel like we just have so much paper, and the process becomes so tedious because they come in, they get the paperwork, and then they have to fill it out, and then they bring it back, and then it goes into my inbox, and then I make sure that all of the information is there. And then I have to find time to scan it. With the 7 other hats that I wear, scanning is usually not real high on my list of things that I have to do today. It's more of I have 15 minutes left to the end of my day. I'll go scan, this pile quick. But then not only do I scan it, but then I have to rename it. I have to upload it into the chart. So what has worked this year is with the schools, when we get paperwork, they're emailing it to me, and I'm able to just sign what I need to sign and then upload it right into the chart. And it's eliminated a lot of paperwork, and it's made the process a lot smoother, and the paperwork gets to the clinician a lot faster that way. And I would like to try to be able to do something similar to that, hopefully utilizing a patient portal, to be able to do that for the adults that we see as well. And so I was just kind of wondering, from the other organizations that are already, using patient portals, how are you utilizing them? And then what features have been most beneficial. That was my first question, kind of a two-part question, but that was my first question. And then also wanted to know if there have been some barriers that I should watch out for. And if there were, how did you overcome them? So that maybe I don't have to make the same mistakes. And then is anybody else using UpDocs? And if you are, what has your experience been with them? Because I'm very excited to dig in from what I've seen of it so far.
Yeah, that's really great, Melissa. Thanks. Can you say a little bit about UpDocs, just in case people aren't familiar with it?
I don't know a whole lot about it, just that we can use it for telehealth, and we can use it. So I believe it's a whole EHR system, but I haven't played around in it yet, so I'm not terribly familiar with it.
And I think Lori's put the UpDocs web link in the chat if people want to take a look at it real quick, if you don't know, or if you're not familiar with it. But obviously, as we all know, a lot of IT groups are, scrambling, right, to try to figure out how to help practices get up and running with these various approaches. And we all know that behavioral health is sort of, this area that really struggles to find good platforms that are useful. And so let's open it up to you all. Melissa, has some really great questions. Other people using portals and what features, you've found to be most useful for your organization. Can someone speak to that a little bit? People aren't using portals? Is that?
This is Sandra at Waukesha County.
Yes,
Our electronic health record, which is called My Avatar, it has a health portal with it, which is called My Health Portal is what we call it. Pretty easy. Before COVID, we had very limited participation. And then with COVID, we very much like Melissa, we needed to get a way for people to sign documents that way. We had to build our forms in the My Health Point so that when we signed people up, they could go to the portal and fill out the forms there. And that was successful. We did that, and people were using it. Well, now that we have people coming back into into the building again, and we're seeing them in person, well, now we're having to work through a different process of how do we get more people to sign up for the health portal now. When they didn't have a choice, because you weren't going to come in and see anybody, people would gladly sign up for it and fill out the forms and use it. And now we have we're going through a process now of how do we get people to more sign up and use the health portal, which we created another team to work on that, as we're pulling in a number of the clinicians to help us drive towards them to use the health portal for exactly what you said, John, and we talked about information blocking and all of that, because this is our tool to do that, but we have to get the patients to sign on. They have to sign up. We can't sign them up ourselves.
Right. And you're on target, Sandra. From some of the stuff I've read, getting your clinicians to talk directly to patients is a great strategy. And then getting people signed up has been identified as one of the challenges in a portal. So, and it's interesting, right, that when there was not a lot of choice and everybody was doing telehealth, they were a lot more willing. But it's interesting how difficult it can be once they can be back in house. So so still working on it then, Sandra? Is that where you all are, trying to get more use of the portal going?
We are, and we have we're talking about bringing on an individual for a period of time to kind of head up the kind of like the drive to get people to sign up, because people have a hard time with knowing, how do I do this? How do I manage? Because we're going to send you a link, and then you need to go through and sign up, and people struggle with that, you know, whether it be on a computer or on your phone. So we want to make it so that we have someone they can either sit with that will walk them through the process. And then we're working to put in a plan on going forward. How do we sustain that?
Yep, excellent. I think that's another great strategy too, Sandra. Is some of the research I've read has pointed to the fact that having someone help the patient sign up and go through that initial process is very useful. So obviously we don't all have that, but using the clinicians to motivate them and then having someone help them walk through that initial process, those are two great strategies. Other strategies, people using portals, or what you found useful, or what your experience is so far?
Similar,
I was gonna, no, you go.
I was just going to say, similar to this UpDocs form, there's a HIPAA compliant version of software online that we use that's called Jotform that we ended up kind of incorporating in some of our introductory emails to people, along with privacy, informed consent, things like this. And it has been pretty mobile friendly. It is not a free service though, so I'm not sure how much it costs monthly. I know it's a subscription service, but it is HIPAA compliant. We have really struggled with the usability of our portal. That's why we haven't been really putting a lot of energy and effort into it, because right now it would take a lot more people power than we've got. But in the first session like that, we are connecting to the person via video. That's where we actually will walk through and say like, hey, I see you didn't get a chance to fill this. Let's do it together. And that's how we've kind of navigated that.
Yeah, that's a great approach. And Claire, can I ask if you found that, because one of the things that I've learned as I've looked through this, they say, you know, a simple and usable portal. So is that part of what you're struggling with, is maybe the portal isn't as simple as you would like?
Yes. Yeah. Signing up for it and navigating the portal that we currently have in our current EMR, not so great.
So imagine that can vary quite a bit among the vendors in terms when you're, you know, some of you I know are looking at implementing EHRs. So it may be something to think about, right? And Sandra made the great point about information blocking is sort of making portals even a little bit more of an important piece of our work. So something to think about if you are looking for an EHR is, what does that portal look like? Is it simple? Is it easy to use? Are you going to be able to, you know, get that going and use it both for your organization and for your patient population, right?
This is Lynette, and I was going to interject a couple things. I've been really familiar with UpDocs for quite a long time. In my other life, I work at a practice that uses the EHR Practice Fusion, and they have a close partnership with UpDocs. And UpDocs is not a standalone EHR. It's a solution. They kind of started out in patient reminders. They moved to the telehealth and portal arenas. So they do have a reputable reputation. That's redundant. So I haven't worked with them, but they have been around there, but they're not a standalone EHR. And secondly, I've done a lot around patient portal adoption in the last while. And one of the best ways to encourage patient portal adoption is to get buy-in from the person at your organization that answers the telephone. So if they're can recognize that if we can change behaviors of our patients to see the value and make the portal easy, that it'll really free up time for your front desk person to do their job instead of just answering calls. So that's been a great approach. We've also had people in the past do little giveaways. So maybe you give out an iPad, do a drawing or a raffle as people sign up for your portal. But yes, having it mobile friendly, making sure your staff has buy-in, having multiple touches throughout that patient where you talk, the provider talks with them, the front desk talks with them. You know, constantly giving that offering to sign up for the portal helps with adoption.
Thanks, Lynette.
Thank you.
Anybody else, other people using a portal, or is a lack of sort of conversation an indication that we're not using portals very much, or it hasn't been very useful to us? Can you give me some feedback if you're kind of one of those folks?
We're part of a hospital, so we have Epic.
Okay, so you
And-
got the whole.
Well, yeah. So with Epic, you can have your visits through the schedule, but we're not there yet. We have the Zoom. We have subscriptions to Zoom, the health Zoom, and then also DocSeeMe. We're still using. So we are trying to work on getting folks signed up for the portal so we can conduct the visits through Epic. And then as far as forms, we are still mailing forms, and it's,
Wow.
Epic is, there's a lot of great things it can do, but there's a lot of bells and whistles, and you have to have different subscriptions to different things in order to use them.
Thanks so much, Shanna. I mean, that's really interesting. Here's one of the premier EHRs, right? And yet you're still struggling with these various ways of, having to, address like telehealth and forms and stuff like that. So, yeah, I think we would tend to think like, oh, you got Epic, you're set, right? But not so much, huh? Okay. Wow. Thank you. Other folks, so somebody maybe speak to like not using a portal. Are there reasons people are maybe you have one and you're not using it, or do people not have portals? What seems to be that piece of it?
I can go. We switched to Streamline for our EHR in 2018, and because of meaningful use, we wanted to get people into the portal. So it was a deadline. We had to get it in so we could get reimbursed. And we said, people just log in. Don't care what you do, just log in. And we had ended up giving, just log in. We ended up giving gift cards to the people. I think it was like $5. But then with COVID and the amount of time it took, it kind of just stopped. Plus the amount of stuff we can do with the portal, like scheduling, we're not doing. There's very limited uses for a person to go into our portal. It's not a lot of information they can get, and that's on our end. What we do for documents is we had to buy a DocuSign, and that's been working so far. We still don't have a lot of consumers coming into our facility. It's a lot of telehealth. Our community programs do go out, so they're able to do, our people don't have the technology oftentimes, because
right.
we deal with people with severe and persistent mental illness, so they just don't have the technology. So we created kiosks during COVID, so people could come in to a kiosk at Journey and do a telehealth appointment with their doctor. So we've had to come up with some workarounds, but like everyone, our portal has not been used.
Great. Thanks, Becky. I can tell you as a clinician myself, who was using some of the portal features, the ability to message back and forth with patients, I found to be a very useful thing. So if you're trying to get some clinician buy-in, I found that to be a real help. Hadn't used it in the past. As patients began to send me messages through the portal, and I was able to respond and sort of deal with issues without having to chase them down on a phone call or make them come in for an appointment, I found that was really helpful. And I think both the clinician and the patient, sort of benefit from that. So if you have that ability to connect with clinicians and their patients, that's something that I found was motivating.
John, this is Lori, and I just wanted to interject a couple of ideas as well. Is in my experience with working with clinics, what seems to be the case is that, the more functionality that is available through the portal that the patient really cares about, you know, the easier it is to get patients to sign up for it. So even if you're not at a point where you're able to schedule appointments through the portal, if you are at a point to request an appointment or send a message, that can be something that's really helpful. So as you're sort of thinking about that, and I know that some of the resources we're going to present will give even more ideas about that, but you know, there's really an inverse relationship there with the number of functions, and especially with what's important to the patient versus how successful a launch of your portal will be. I do remember very well, Becky, those meaningful use days where it was just like, just get them to sign in. And that's a good first step, but it needs to be, there has to be something of value there on both sides of the equation.
And Patty, you had something in the chat there. You're trying to get a portal up and running?
Yeah, can you hear me?
Yes. Yeah.
Okay. So yeah, with telehealth, we were scrambling as well. And similar to what I think Melissa was saying, it was not a simple process of just giving them our registration forms and consent forms and having the EHR format those and get those going. It was a month-long process of just getting the EHR to get them formatted in a way that would even work. So that took us months. So we are now probably about 3 or so weeks into testing it. So so we have a very tech savvy clinician and a not so tech savvy clinician that we're kind of using as our guinea pigs. So, and we're starting by just using it in our intake department. So it's when new people are calling in to get scheduled for the first time. And so primarily using it so that they can get the registration packets, have access to all those consent forms, the release of information forms right away. So, so far it seems to be working pretty well. Again, getting clinicians to adopt something new is also a little bit of a struggle, because once the paperwork does come back, like maybe Melissa was talking about this, that it comes right back and it's in the portal. So there's not all these hands that are touching paper and having to get it to the next person and all of that stuff. So it just is all nicely contained in the portal. So I think our goal is to be able to use it for those initial intake appointments and getting all that paperwork. And for clients to be able to go in and see what their bill is, and to be able to see what appointments they have scheduled. And then as we kind of work through those and everything's working okay, then we'll continue to expand it for other things.
Yeah, Patty, that's interesting. Are you during the intake process, are you signing them up for the portal then?
Yeah. So from our end, just to do that, we just need their email address, and then the portal, we send them an email, automatic generated email through the portal. They sign up, and then the forms that we need to send them show up on their end. They can go in and just insert the information and sign them electronically, submit them back to us. And then it just comes right back into our portal and it's stored.
You know, it's an interesting strategy though, right? I mean, to start with new intakes and develop that process over time, you hope that becomes more and more of your population. But I think that's an interesting strategy, Patty.
Yeah. So and primarily we do that for people who are choosing to do telehealth, but we're also offering it for people who are continuing to want to come in and do face-to-face. We're giving them the option to do all that registration ahead of time, so they don't have to come in early and do paperwork when they get there. So
nice.
And John, it looks like Lisa K may have her hand up.
Okay, Lisa.
Sure, I can weigh in on not implementing a portal right now. Brown County, Health and Human Services, we're similar. We're on the same EHR that Sandra Masker, Waukesha County are.
Okay.
My avatar, and we know that there is a a portal tool available to us. We have a quote. We really only pursued the quote because of the impending doom behind information blocking. So I mean, in a kind of a rock and a hard place. I don't have a compelling business reason to pursue it. You know, during the pandemic, we got by with expansion of Adobe Pro licenses to do fill and sign, paired with rapid adoption of Microsoft Teams. So it feels like, you know, the whole client communication got where it needed to be, as interesting as it is, you know, a better secure tool. But it is a double-edged sword, right? The ability for clients to just, you know, send these secure messages in the middle of the night isn't necessarily going to make our clinicians happy or improve service. And when it comes to the timing of our behavioral health clients getting at their own results, I mean, I get the concept of information blocking, but there's so much in a raw test result that we need to frame and be a part of, as opposed to them logging in at 2 a.m. to see what the lab said, positive or negative. So there's definitely a much bigger investment beyond just the cost of the tool, which is in and of itself pricey. Just changing everyone's workflow to look for the messages, to expect the messages, to, you know, remember that our processes, that our clients are going to have information available in a different time frame than what we're used to. It's just bigger than what we're willing to bite off right now, unless somebody forces us to.
Right. A lot of challenges. Thanks, Lisa. This is one of the reasons that we thought this was a great topic, right? Because it really is challenging. It's something that's becoming more and more important because of the information blocking piece. Of course, the pandemic and the telehealth and document signing and all made it another, you know, big issue. So obviously, I think we're going to be all dealing with this for a while. It was kind of interesting to me to hear Shannon talk about how even Epic didn't have all the answers. So, you know, that was enlightening and helpful. So we don't have to feel like we're alone in the boat just because we maybe haven't figured it out yet. So other people that have comments, I know that barriers, anybody want to speak to other barriers that you've encountered at your organization in terms of getting portals working?
And then, sorry, John, this is Lynette. In addition to barriers, I know we have a lot of folks on the call today that really are looking to implement an EHR and utilize a portal. Does anybody want to offer some positive opportunities for what to look for in a portal? I know a really good thing that came up very early is, you know, mobile friendly. That assumption that some of our patients don't have mobile health has changed to most of our patients only have mobile health. So I know if that portal functionality can be viewed mobile in a mobile device, that's great. But any other tips and tricks for folks looking to implement a portal?
So I'm going to take that because of the lack of response, people are as confused about this as the rest of us. We're really trying to find our way through. And Lynette makes a really good point. I know a lot of you are looking to implement EHRs. So, you know, this may be something worth paying attention to as it's becoming more and more important. And I think that issue about the mobile devices, I know a lot of folks are working with clients. We talk about how there seems to be an expectation that everybody has an internet and has a connection and has the ability to use all this. And that's really not true for a lot of our patients. And so, you know, to Melissa's point, you know, if you only have a phone, it makes it a very different process to use a portal. And so big challenges for some of our clients, right?
You know, John, I don't know if this is a good opportunity to even maybe switch over and talk about some of the resources that there are available that kind of help to answer some of these questions as well. Just let me know if you're ready to share the screen. Otherwise, you know, this is a really good discussion. Sometimes more questions than answers.
Yeah. Does anybody have, speaking of that, before we get into sort of some of our resources, I know Lori put the UpDocs link in there. Does anybody, if anybody has resources that you've used or that you found helpful, and you throw a link in the chat for people, please feel free to do that. You know, maybe you found an article or some information or, you know, things like that that might have been helpful to you. Feel free to put that in the chat for us, because we're all looking for some tips, tricks, solutions, ways to make this work. And our team, I know, continues to talk about the information blocking piece, as I've heard a couple of people refer to today. And we're actively trying to determine, you know, what's the impact in terms of portal use and information blocking. And Lisa Kay talked about, you know, having results available for our patients and them being able to view those records and the timing of that. So there really are some interesting things to continue working on around this. So you want to, Chris, would you want to run through some of the resources that we were able to find related to this?
Sure. Why don't you switch over there, Lori? Thanks. Yeah, so by no means an exhaustive list of resources here, but just some key ones that we thought might be helpful up front. So the first is our old friend, the patient engagement playbook from healthit.gov. Along with the information behind the link, there's just a plethora of information out there on the healthit.gov site. Second is a presentation. I think it was 2017 HIMSS, but still pertinent today. Lots of good information on that PowerPoint from that HIMSS conference. And then third one there is how do patients with mental health diagnoses use online patient portals, observational analysis from the VA. Little abstract that kind of looks at, you know, how those folks are accessing the portal and what they're doing once they're on there. So that's, you know, another great resource to take a peek at. And then of course, as mentioned, and also the link in our chat, at the Star Health IT Radio podcast, specifically the electronic patient engagement. What is it? Why is it important? Some good insights there, good thoughts, information. Also, while you're perusing the Health IT Radio webpage, there may be some other resources that you find helpful. I don't know if John, or anybody, if you wanted to dig into these a little deeper, but I think, you know, for the most part, folks can look at them on their own and check them out, and might lead to some other, you know, might lead you down some rabbit hole, other links embedded in some of these resources. So that might be helpful.
Yeah, you know, Chris, I'd encourage people to take a look at the healthit.gov website. I think it's one of the things that our team has been trying to encourage people to consider keeping up to date with that. And that patient engagement playbook has, as you say, a lot of resources and a real nice outline of, you know, things that you can use. So I found that to be really interesting. And that abstract on the mental health diagnoses, it was interesting to me that the diagnoses that tend to use it more and the ones that tend to use it less. And so there's some interesting stuff there in that regard. And Shannon, I see you put a link to OpenNotes. Can you say a little bit about that for us?
Well, we had about 2 weeks to prepare for the CARES Act, how it was going to affect us, excuse me, at our clinic. And while we were doing our scramble and our research, we came across OpenNotes. And OpenNotes it's free information where there are professionals across the country, different hospitals, different clinics that get together and talk about how they've been sharing information and specifically they've been talking about mental health information, substance abuse as well. And so they have done a lot of research on what the law is and what needs to go, what information needs to be shared, what types of things they found, how it affects their patients, how it affects the clinicians or the doctors. And it just has a lot of tips and resources to use. A lot of webinars, like I said, so I think it is really worth checking out.
So Shannon, is that something that you all are going to try to start implementing at your organization, the use of open notes?
We have been.
You have been?
We don't have all of them. We know we are we're doing a really slow rollout. You know, trying to figure out what has to go right now for our inpatient side, because we do a mental health stabilization and we do a medically managed detox. We are still trying to figure out how do we have the notes roll out? When do you have them roll out? You know, there's immediate, and some people say immediate is different. So open notes went over, they had a lot of discussions around that. And so that was just really helpful. And it's always helpful knowing that there's other people struggling in your boat with you, you know?
Right. Yeah, I've looked at their website some, and I think it's fascinating and interesting that the clinicians who do try it are beginning to find that it's very useful actually to have those conversations openly with clients, and sometimes even collaborate and co-create the note in the session. And I know that for a lot of clinicians, that timing of having sessions and trying to get your documentation done can be challenging, sometimes leave you there late at night trying to get your documentation done. So actually doing open notes where you create it in session, so the note is done when the patient leaves and you've talked through it probably in terms of a treatment plan, et cetera, and what our goals for next session are. So there's definitely a lot potential there. And so I appreciate you bringing that up. And it also helps us address information blocking, right? Because we were going to put that information right there in the front. So great. I appreciate you bringing that to our attention, Shannon.
You're welcome.
Yeah.
You know, that is a really hot topic now, John, and I did just want to offer everyone, you know, Metastar, we have put together quite a few resources around that, including this most recent podcast. The healthit.gov also has a number of really good resources, and we've kind of compiled sort of our short list of favorite resources, and especially around sort of what do you do with it, not just the definition of what is information blocking now with the ONC's final rule that has just come into effect, but you know, how are ways to take a look at your policies and procedures in order to be compliant, as well as, you know, such techniques as open notes and such. And so, you know, if it's helpful to the group, that is something that we would most certainly, you know, be able to offer and get out to the group as well. Some of those recommended resources.
I know we'll always take whatever we can get.
I hear you. All right. Well, you know, in respect for everybody's time, I want to thank everybody for your participation today. Great discussion. Obviously, patient portals are going to continue to be something that we're all going to have to pay attention to and a challenge for us. So you all keep working on it. We're with you. We're willing to, like Lori says, provide you with whatever resources that we can to help you. I want to thank Melissa for getting us going today and talking a little bit about this challenge. So that was really great, Melissa. Our next session will be in July. It'll be July 20th. And we would like to use your suggestion of measurement-based care and clinical quality measures as our next topic. So if someone is willing to do a brief presentation like Melissa did on, you know, how you have maybe tried to address measurement-based care or clinical quality measures. We would love to hear from you. So please reach out to your Metastar representative if you're willing to do that, or email one of us, and we'll definitely be glad to talk to you about that. You can see it's not a big time investment, just a quick description of what have you done and what questions do you have that you would like some feedback on. So please submit any other topics, things that you're interested in talking about in these discussions to Metastar folks here on the call today. And I just want to thank everybody for all your hard work. I really appreciate your sticking through the pandemic and all the challenges of telehealth and everything to make sure that all our patients here in Wisconsin got the care that they needed. So you guys are real champions and heroes. Thanks a lot. We'll see you in July. Okay.
Thanks, John.
Thanks, everybody.
Bye-bye.
Bye-bye. Thank you.
See you, Fern.